Millions of Americans went to bed healthy. You might have been one of them. Then, one decision quietly redrew the line between healthy and diabetic. Their bodies hadn't changed, only the line had. At least 1 million people crossed that line without a single blood test changing. But lines like these aren't moved overnight. So who moved it? Why was it moved? And what did America gain or lose because of it? To answer those questions, we have to go back to 1997. For almost 20 years before that, the line barely moved. If your fasting blood sugar came back under 140, you were normal. Above it, you had diabetes. That number came from a 1979 panel of researchers, sponsored by the National Institutes of Health. And it wasn't arbitrary either. They'd built it on the best evidence available at the time, tied to when eye disease and blood vessel damage started to appear in long-term studies. Take Frank, 54 years old, works construction outside Columbus, Ohio. In 1996, his doctor draws blood before breakfast, and it comes back at 132. Borderline, the doctor says. Watch your sugar, keep moving, come back next year. Frank doesn't think much of it. No callback, no follow-up test scheduled, no conversation with his insurance company. He shrugs, tells his wife it's nothing serious, and goes back to work the next morning. As far as medicine is concerned, in 1996, he isn't diagnosed with anything at all, and as far as Frank is concerned, there's nothing to be concerned about. People in 1979 weren't necessarily eating less sugar or fewer processed calories than we do now. Some of that was already working its way into the American diet. But daily life still demanded more of the body just to get through it. Fewer households had a second car. More people walked to work, walked to the store, did the physical work around the house that today gets done by a machine, a dishwasher, or a delivery driver. The sugar was going in, but more of it was also being burned off before it ever became a problem on paper. That was the deal then. Diabetes, in the public imagination, was a disease you could see coming. The thirst, the fatigue, the weight dropping off for no reason. A number so high on a lab report it was hard to miss. Back then, most of us didn't have a treadmill in the garage or a step count on our wrist. We just walked because the day required it. The 140 line wasn't just a value tucked into a medical chart. For someone like Frank, it was the difference between an ordinary Tuesday and a diagnosis that follows him for the rest of his life. But that number was never meant to be permanent. It was built on the data researchers had access to in 1979. Real data, but 2 decades old. The question, by the mid-1990s, was whether that evidence still held up, or whether newer research was quietly telling a different story. Here's what researchers were looking at. Teams tracking diabetic retinopathy, damage to the blood vessels behind the eye, noticed something specific across several long-running studies. The risk of that damage didn't rise gradually as fasting blood sugar climbed. It rose sharply once glucose crossed roughly 126 milligrams per deciliter, not 140. That's worth sitting with for a second. The evidence: a documented repeated jump in eye complications starting near 126. The context: the existing diagnostic line sat 14 points higher, at 140. The implication: for almost 2 decades, a measurable number of Americans, people exactly like Frank, had been quietly developing early complications while the system officially told them they were fine. Starting in 1996, an international expert committee convened by the American Diabetes Association spent months weighing that evidence against nearly 20 years of old criteria. There was a second, quieter factor in the room too. For decades, confirming a diagnosis meant a thick glucose syrup, a clinic chair, and 2 hours of repeated blood draws. Almost nobody wanted to sit through it. A single fasting blood draw was faster and easier to standardize nationwide, but only if the number attached to it was right. Here's the strange part. Frank had no idea any of this was happening. 500 miles away, a room full of researchers was quietly deciding what word would define the rest of his life. But here's what nobody fully expected going in. Moving a medical threshold was never going to be just a scientific decision. It's a legal one, an insurance one, an identity one. The same number that flags early eye disease risk is the number that decides who gets to write the word diabetic next to your name, on a chart, on a policy, on the rest of a life. In June 1997, at the American Diabetes Association's annual meeting, the expert committee released its findings. The diagnostic cutoff for diabetes was lowered from a fasting glucose of 140 milligrams per deciliter to 126. Published that year in the medical journal Diabetes Care, the change moved into American clinical practice almost immediately. A brand new category was created alongside it: impaired fasting glucose, for anyone testing between 110 and 125, an entire zone of medical concern that, on paper, hadn't existed the year before. The World Health Organization reviewed the same evidence and largely agreed, adopting similar criteria 2 years later. The committee also recommended routine screening for every American over 45, every 3 years, symptoms or not. Diabetes had quietly shifted from a disease you noticed to a disease you went looking for. Nothing about Frank changed that week, except the paperwork. His number, 132, hadn't moved an inch since his last checkup, but the line had walked right past him while he stood still. Under the old rule, he was borderline, told to keep an eye on things. Under the new one, published that same year, he was diabetic. This time, the letter from his doctor's office does arrive. A follow-up appointment, a new prescription to discuss, a form for his insurance that used a word his old chart never had.
I didn't feel any different that week. I just suddenly had a different name for.
Nothing in his bloodstream had changed. Only the definition had. Contemporary estimates suggest at least 1 million Americans sat in that same 126 to 140 gap. People who went to bed 1 year watching their sugar, and woke up the next carrying a diagnosis they hadn't earned through anything their body had done differently. What's genuinely still debated, even now, isn't whether the science held up. Later reviews confirmed the retinopathy data. It's the scale of that overnight effect. Some population studies found the new criteria barely changed how many people qualified as diabetic overall. Others, in different groups, found real jumps. Exactly how many people the line moved for is where researchers still disagree. Today, roughly 40 million Americans are living with diabetes, about 1 in 8 people. Layer on the category that 1997 invented, and the number climbs further still. Over 115 million American adults now fall somewhere inside that in-between zone the old system never even had a name for. But here's where it gets personal. A large majority of people who technically qualify for that in-between category still don't know they're in it. The line got easier to cross. It didn't get easier to see. So where does the rest of the growth actually come from? It gets stranger before it gets clearer. Some of it, honestly, is genuine. In the early 1960s, roughly 13% of American adults were classified as obese. Today, that number sits close to 40%, nearly tripled. But before you assume it's simply more sugar, sit with this. Per capita sugar consumption in America has actually declined somewhat since the 1990s. The sugar going in was never the whole story. What changed is what happens after the sugar goes in. As cars became the default and physical work gave way to desk jobs and doorstep delivery, the old balance, sugar in, sugar burned off, quietly broke down. We traded movement for convenience, one small decision at a time, and rarely noticed the trade was even happening. Researchers point to that shift in daily movement as a major, independent contributor to the rise in obesity and insulin resistance. Not the whole explanation, but a piece that's easy to miss if you're only counting calories. The line the committee drew in 1997 to catch eye disease a little earlier now quietly defines roughly a third of the entire adult population as somewhere on the spectrum of concern, for reasons that reach far beyond what's sitting on anyone's plate. So, who moved the line, and why? A committee of researchers in 1997 following real evidence about exactly when the body starts to suffer. Not a conspiracy, not a mistake, a recalculation, made in good faith, with consequences nobody in that room fully mapped out in advance. Frank never got sicker the year the line moved. He just got relabeled, and that's the part worth sitting with. Somewhere, right now, there's a version of you sitting at 124. Perfectly normal, for now. One committee meeting, one published paper, and that number stops being fine. Maybe you already know your number, maybe you've never asked. Either way, you don't get to decide what it means. Someone else already did. In 1997. Someone else will again. The line isn't fixed. It never was. It's just waiting for the next room full of researchers to decide, once again, who's sick and who isn't. If this changed how you see a number you've probably had tested yourself, that's exactly what Health Evolution TV is here for. The story behind the things we take for granted.